Good morning, everyone. On the dais, off the dais, respected chairman of this institute, Senthil Kumar sir, and Nisha madam, and Vikram Hariharan sir, this group, and other principals, and the directors, and the faculty members. Mainly, I should thank the Potsalvi ma'am and Karthik sir for this. They invited me, it's a long back, actually this time only I got the, what I say that is I am very busy lady. So this time I got the permission and I came here this for this occasion. So buddy nurses and dear parents, I am privileged to be here for the auspicious gathering today and address you all for the lamp lighting ceremony. As a nurse, when I stand here, I feel it's always great to welcome and also address to the budding student nurses who are entering to the nursing profession. Yes, as sir said, it is a E.S Nursing College. It's a very famous. They got a NAAC accreditation as well as I think in the Tamil Nadu is the first college. I am very proud to stand here as a nurse. And also I should appreciate the first parents. You have selected this E.S Nursing College to put your students, that's your children, those who are going to become a professional nurse. You have selected this college because as sir said, so many are there in the abroad countries, as well as sir forgot to tell that is people are in the JIPMER also. Because this time 392 nurses were selected. You people are participating in the NAAC examination. Sir did not mention that. The faculty members are training nursing students to write the NAAC exam. This time they have joined in JIPMER also because I have selected and I have given the orientation program in JIPMER. So I am sure that is again you people will come to JIPMER, you will meet me there. And let me talk about my story, how I came to nursing profession. So I am basically diploma nurse. They have written the MSc and PhD nursing, all those things. After entering to my profession, coming to JIPMER, I gained post B.Sc and MSc nursing. Currently I am doing my PhD nursing. And I should thank my parents. They put me this nursing profession where I was studying there. St. Anne's School of Nursing, Toothukudi, Nun Sisters Convent, Malayali Sisters. Manaslayo? Yes, there was very strict. Sir was telling us they are good in English. So I am from the Pakka village. I don't know English. Children, please don't hesitate to talk whether you are right or wrong. Try to speak with your faculty members and teachers and your colleagues. We learned very much, that is the discipline they taught us. And recently I went to my college. They awarded me, they appreciated me because I am holding such a post in JIPMER Hospital. So many are there. Because of this Nightingale Award, I was appreciated by my teachers. My teachers, there is a principal 80-year-old, she came for this function. I was very proud. And still I can say this, I am proud to be a nurse. So you got to struggle. Cannot say that it's a very easily, cannot get all the things. So study, learning is a lifelong process. You cannot say once you enter into the profession and getting the salary, people will once you enter to the central government job, they will get around 1 lakh. Sir said that is a 8th pay commission. Yes, we are going to get it. Entering to the profession, you will get 1 lakh salary and all other benefits. Because I am telling, no, that is I have studied my all the degree after coming to Jipmer, all the facilities. I have gone to all the state India, all over India I have travelled by flight. All the benefit will get it. So Navir sir, I am motivating you. Please, whatever the things they are giving you that, please learn it in Pakka. A few words about the lamp lighting and the oath. Sir, profession is the nursing, of nursing. When you study, you have two important. So during your first lighting, lamp lighting, the entering to the profession, and also after completing and going to become the trained nurse, going to practice. You will get a license to practice. Remember that Florence Nightingale oath with a lot of dedication and compassion. Lamp lighting ceremony is auspicious occasion and every nurse's life with a reference to the Florence Nightingale. Sir was telling that is everything. Knowledge and which removes the ignorance and lasting wealth by which lots could be achieved, but also signifies the enlightenment, experience, hope, love and comfort of positivity. See, you should remember that once you are entering to the nursing, you should remember 3 C's. Compassion, commitment and competent. Compassion. When you become the clinical nurse, when you are coming to the hospital area, working with the patient is think about your own blood, that relatives. Then only you can be a nurse, clinical nurse. Sitting in the classroom and teaching and everything is your teachers are doing. Coming to the clinical area, when you are talking to the patients, you become knowledgeable as well as with the empathy you have to treat the patient. You cannot talk to the patients very rudely because you are a nurse. You are not a doctor. More than the doctors you are. 24 hours, 24/7 you are only going to become with the patients. So you are going to teach the doctors because I have done it. Many doctors, they learned from the nurses only. Basically, I am the OT nurse, open heart surgery. 8 hours, 12 hours I stood for the cases. I have taught many doctors. Now they are HOD of mine. I am working under them. But they don't forget whatever I have taught them. See, from wearing the gown to gloves and holding the instruments, how to hold the instruments, how to hold the knife, everything we have taught them. So now they are a HOD. See, when you are the nurse in a family, more than the doctors, one nurse in a family, you are more than all the speciality. You can treat our relatives. Fever, can't you treat? You can do it. You can give the paracetamol for the fever, abdominal pain. First aid measure at home itself we can give. So I am giving the treatment because I am bold enough to face all the things because I worked in clinical area. More than the doctors, I will tell them this is the case which you want to prioritize. By experience, you will also become like me. By experience, you will gain more thing. More than the doctors. Now the so many specialty has come. Branches, previously medicine and the surgery and all other departments. The surgery and the medicine became different specialties. So in a nurse, in a family, can take care of the entire village. And also, more support from the public will get it. They cannot reach the doctors easily. But the nurse, they can reach the public very easy. Your identity will show in the community area. And also commitment. When you are committed to this profession, You cannot admit any wrong medications or wrong procedure to the patients. That's why you got taken the oath. You keep in mind that is whatever the things, in Pakka you have to do it. The medications and the procedure, everything you learned from the faculty and in the classroom and your colleague and the doctors. Consider your own, then you will not do the mistake. And coming to your own health, people are very fascinated with junk food. Please don't take. Maintain your health and your personality. You are wearing the uniform that shows you are the nurse identity. Maintain your professional dignity and Pakka uniform and your personal health. Avoid your junk food and eat healthy diets. So nowadays, they are very, very much interested to take, that is a fascinated burger, pizza and all those things. But in the village, whatever food, so even now, I used to eat, when I am going to my village, I will ask my parents to keep rice water. So Indian Horlicks, that is called previously. We used to have that one. Kerala people, na manasalayo, ye kanjivalna ye uppu kandam. Yes, we used to have that one. See, it is a healthy diet. See, MMC College of Nursing, that sir was telling, that is a Madras Medical College. They are treating the urology patients with old rice and water. It gives a best result, seems. They proved, the study they proved. People are running for that. The village, they are giving, that is a ragi kul, no? Ragi malt, everything, it is a packed item. But we have in our own home and we are preparing it. People don't take it. But they are going to the 5-star hotel and everything. It is, they are serving in a well-designed vessels. It's very costly. Yes. So whatever we have at home, that will help us. So dear students, maintain your health and take your good nutrient food. Last not but the least, coming to ABCD. Sir was telling that is a simulation lab. Basic life support we are learning and we are making every village people and the auto fellow, everybody should know that is a basic life support when you are going to become a nurse, and they should know the first aid. When a person is suffering with a heart attack or any accident case, they should know what is to be done. So likewise, we the nurse should know ABCD, so airway, breathing and circulation, and last is a disability. We are not coming to that, coming to your nursing. So ambition, always you should have a high aspiration. You should not stop it with your UG level or diploma level. You should have the masters, and also there's a nurse-led practice. We have the MSc nursing, forensic nursing. We are going to have and have the separate clinic also, we can run it. So it later comes, that is they have made it in the nursing, Indian Nursing Council has given the permission. Very soon it will come and we are going to become the pioneer and we will practice in the villages as a registered nurse practitioner. We are going to have it. Nursing, we have the wide scope. We can have the private practice as well as they are telling that is a minimum salary 40,000. They have, the Kerala news has said, and the sir was telling in Tamil Nadu 37,000 the initial payment. But the Kerala nurses, the trained nurses association, they are fighting still to have a 40,000 initial payment. People are finishing the engineering, they are getting At the most 20,000 nurses. Soon after finishing it, we are going to have 40,000 in the corporate hospitals. And wherever we go, that is Apollo and Kaveri Hospital, I have gone. I have seen you people there also. This is from the E.S Nursing College. I have seen the people are working there. Because in the Kaveri Hospital, Kovilambakam, they have that is a very famous cardiologist. Because I used to go there, I have seen the people there working. So I am proud that is our people are there also. And also there is a behavior changes. See, when you become the nurse, we have the certain discipline. We cannot as they like that the playable. Some behavior changes will occur. That is when you have there is a uniform. Just once I traveled in the Indigo flight. One fellow was treated in Apollo Hospital, north side, with diabetic, and son brought him in the flight. And whatever the advice is given, and son had given the medications and diabetic medications without food. So middle of the travel and 3 hours, Chennai to Guwahati I have to travel. So middle of the travel, and that old man was hypoglycemic, that's a sweating and everything, and he is about to go into arrest. And we the nurses, people, we should not say that we cannot hesitate there. And the Air India, this Indigo people, they were asking who is the medical person here. So we 15 of us got up and we said that we are the nurses. See, that is people are hesitating to say that is a nursing professions, we cannot tell it out. No. Please change your behavior. Proud to say that is you are a nurse more than the doctors. See, we 15 of us got up and we said that we are the nurses, we will take care. We were searching for the first aid in the flight, there was nothing. And with this smartphone, we checked that is a SpO2, pulse rate and heart rate and everything. There is no eye fluids to start. Because I went through all the medical report and everything, and I asked the son, because the Hindi wala, so I asked him what was given to him. So he said that without food he has given the sugar tablet. So he went into hypoglycemic and we got some juice and everything, we had taken care, and safely we handed over the old fellow in the airport authority. So we have taken that we showing that we are the nurses, and our behavior, there was save the life of the one old man. Many things I can say that is a thing. Because I am there, we stood that we are the nurses. Another thing, there's a competent. We should have the competent enough to practice. Sufficient skill and knowledge and the experience and properly qualified. See, you people are regular B.Sc and regular diploma nurse. Nursing is a skill-based training, not a reading the books and doing on the thing. This is a E.S Nursing College is a campus, it is a separate for the nursing college. I should appreciate that he is producing that is so many nurses. Next to our Florence Nightingale, that is we can say that God should give the strength and thing to their family. Yes, here they are giving that is more than 121 nurses. See, you are going to learn from on the patient as well as before going to the patient, simulation lab. So the delivery conduction and basic life support, all the things you can learn on the thing, that is giving injections and calculating the medications and everything you are going to learn on the simulation lab. And after 10 days, they are going to open the 300-bedded hospital for your practice, clinical practice. So, we should appreciate that you are going to have direct patient care also. So, beforehand, you are going to practice on the robotic, that is how to go about all the things, all the procedures. So previously we were learning we were having our own IM injections and taking samples, everything, and our own we were doing it. Now you are going to practice on the robotic, and the directly you are going to practice on the, after that, on the patient. So you are competent enough to practice on the patient after getting this training. And also you should update your knowledge. Now this is a competitive world. You cannot simply keep quiet and writing the many competitive experience exams. You can have the job opportunity the foreign countries, and so many I have seen these boys, they have the good opportunity in psychiatric specialty in abroad. The rural area there also, most of the psychiatric nurses are wanted. The boys mostly they will select a psychiatric specialty. You are highly paid because rural area, you know the culture of the foreign countries. They will not, up to our marriage and after marriage also, parents will not take care there. Certain age they will leave the family and they will have their own education and the job opportunity. After some time they themselves become some psychiatric or some other family issues, they will face it because there is no one to take care of them, guide them. There the opportunity for our Indian nurses, most of the Indian nurses are wanted there. The Gulf countries, most of my friends are there. Sir was telling that is an online interview. My juniors and my batchmates are there in Gulf countries and US and UK and many countries there. Argentina, Algeria, many of the places our nurses are there because we are mission trained, and like a E.S College, we are the single campus. And we were given that such a educations and we were selected there. We are competent enough to work in all over India and also in all over the world also. I think after some time the E.S College will go to the space also to work. I wish that thing. Yes. Next thing, dedication. See, you are nurse and you have the dedication to serve in the nursing profession. So God has given the opportunity. Everyone cannot become the nurse or the doctor unless otherwise the God is willing to call you. That is He selected you. He selected you to come to this profession. So your dedication should be there in the clinical nursing. So unless otherwise you are dedicated to this profession, you cannot continue. So personal and professional, like a railway track, you cannot mingle with both the things. If you are mingling with the personal and professional, you cannot survive. You cannot adapt. Family is different, professional is different. So when you have the uniform, you are dedicated to that service. So as a nurse, we have many roles which we cannot done by others. As a nurse, you can work as a doctor, mother, sister, and whatever role. We have the extended and expanded role of more than 20. Educator, leader, advisor, surrogacy, so many. Which there is no in the engineering or some other subject. Nurse can carry all the roles. That's why it's given this nursing profession. So dedicated to human being. It is in your hand. And also the family members, they have given this opportunity for you, and you should be thankful to your parents, and they have selected this as such a wonderful course for you. and completing your service, completing your studies till your end, you can be the nurse only. And many people are still my leaders. So I'm coming and standing before you. My seniors, my teachers, they have given the wonderful education and the experience which I learned from my seniors, I should given to my followers. So working in JIPMER, many 1,800 nurses we are, and the administrative level totally we are 2,000 nurses. So it is not easy to handle them. Like you people, they also come. So whatever we learned from our seniors, the transformation of the nursing service, I am dedicated to them. That is, I am guiding them. I am making them not to do the mistake and which you are going to do in the clinical errors. That cannot be accepted. You have to show your perfection in the nursing profession, and whatever you are committed to do the things. And also, any professional thing, it comes to your mind. First thing, the nursing. And also, the parents, you have selected this profession for your children, and you should support till they complete their nursing. Support them, because they will have their thing, that is, I should not tell it thing, because by seeing the blood, patient will not come with coat suit and all those things. You can see the patients how they will come to the clinical area. Patient will vomit, they will come with many things, smelling very badly, skin disease, and diabetic wound, all those things. Can't even stand near to the patient, and you cannot eat in coming to the college or coming to home. So you have to have your dedicated service there. Bear with that, all those things. So by seeing the dead body, the nursing, I have done this. The whole night I will not sleep, because individually we have to stand and pack the body. The last ritual, all those things we have to do it. You have to compromise and you have to bear with that. Dear parents, please support them when they are in stress or whatever the things they are upset with that thing. Please support them and give them this motivational thing and encourage them in their studies. Most of the time they will be seeing that is a practical and theory is a different way. They cannot, sometimes they will not cope up with that. And you can practical thing, by seeing the patient you can learn many things. When they are coming with many difficulties, we can get head to foot assessment itself. By seeing them, they are with this condition, all those things we can write and we can diagnose also as a nurse. Unless otherwise you get the clinical service, you cannot come over that. So your parents will support always. Dear buddy nurses, from my side, I can tell you that is a thing. Continue your nursing with a highly qualified thing. Update your knowledge. Learn many things. Now AI has come and so many things are going to happen in online mode. You people are younger generation, well versed in computer knowledge. You will learn many things and continue your service. Whichever the thing it's there, the opportunity will come only once only. You cannot leave it that. When it is coming to your side, please catch hold of that thing. And update your knowledge by studying, upgrading your knowledge by having many degrees. And having this, try to get your government job, because the 8th pay is coming and you will get more pay and more allowances also. Now itself I am motivating you. And I salute all the Florence of our nation, and I wish you all the best, dear buddy nurses. Thank you for this opportunity. I thank this organization, and sir was telling this is the first time they have called me. No, this is the third time you called me, sir. I am very much thankful that is a thing you have given this opportunity. I thank you so much for the E.S groups of this institution. Thank you so much. All the best for this.